It's called crisis response because a service user is in crisis. So it's very important that the service is reliable, that it's consistent and that it's accessible to all. The people in crisis might need somebody to advocate for them, but they also need real life options about what's available for them within the services. It needs to be person-centred, as each patient or service user will present differently, so they will. So it's getting all those resources around and having people specifically trained for crisis management.
So it's quite different in the fact that it is two services, one clinical and one non-clinical, which are integrated and connected in their delivery. So that gives us a unique purpose other than other services. The crisis resolution teams is the first component, which is a multidisciplinary team who offer assessment, a rapid assessment, intensive supports over a 4 to 6 week period with individualised supports for the service user in crisis. The other component is the cafe, which is a crisis cafe we've branded nationally as the Solace Cafe. And that's an out-of-hours, non-clinical service that has preventative but also crisis response services offered by the staff in the cafe in a nice, safe, warm environment for the service user. So in the design of the model of care, the service users' needs were central to the design and development of the model of care. We really wanted a rapid response for service users, so within 72 hours for the crisis resolution team, an alternative to inpatient admission so that care can be provided in the home and in their community rather than in an inpatient unit. And also that the service user was involved in the planning, design and their recovery journey is central to the model of care. In relation to the crisis cafe, the cafe is both for those presenting in crisis but also as a preventative support service. And a key aspect of that is signposting information on HSE services but on other community organisational services to really support the service user and their family or carers in finding the right supports that they need to support their recovery journey.